we are going to learn about the spinal cord and its external features. In this session, we are going to learn about the definition, introduction, dimensions of the cord, age-phase changes of the spinal cord, functions of spinal cord, spinal meninges, surface features of spinal cord, and the clinical importance. The definition of spinal cord is a column of nerve tissue that run from the base of the skull down the center of the back. It is covered by three thin layers of protective tissue called as membranes or meninges. The spinal cord and membrane are surrounded by the vertebrae, the backbone. The spinal cord and the brain make up the central nervous system. The spinal cord or the spinal medulla is the most important content of the vertebral canal, and in adult it occupies only the upper two-thirds of the vertebral canal. It begins as a downward extension of medulla oblongata at the level of upper border of first cervical vertebra and extends down to the level of lower border of first lumbar vertebra. Thus, it occupies the upper two-thirds of the vertebral column. The level is, however, variable and the cord may terminate one vertebra higher or lower than this level. And level also varies with the flexion or extension of the spinal cord. It is a cylindrical shaped structure and slightly flattened anteroposteriorly. The dimensions of the spinal cord. The spinal cord measures about 45 centimeter, that is 18 inches in adult male and 42 centimeter in adult female, and it weighs about 30 grams. The age-wise changes of spinal cord. Up to the third month of intrauterine development, the spinal cord extends throughout the entire length of vertebral canal, and the spinal nerves passes through the intervertebral foramina at their level of origin. Thereafter, the vertebral column grows faster than spinal cord, and the terminal ends of the spinal cord gradually shifted to a higher level. Consequently, at birth, the spinal cord ends at the level of third lumbar vertebra, while in adult it terminates at the level of lower border of L1 vertebra. The knowledge of the variations in the vertebral level of lower end of the cord is important to avoid injury to the cord while performing lumbar puncture, especially in children. The major functions of spinal cords are the execution of simple reflexes and the transmission of impulses to and from the brain. Then the coverings of spinal cord. The spinal cord is surrounded by three protective membranes. They are called as spinal meninges. From outside to inwards, these are dura mater, arachnoid mater, and pia mater. First, the outermost covering of spinal cord. It is called as dura mater. The spinal dura, which extends from foramen magnum to the lower border of second sacral vertebra. In the space between dura mater and the vertebral canal, it is called as epidural space. This space containing loose areolar connective tissue, semi-liquid fat, and intervertebral venous plexuses. The space between dura and arachnoid mater termed subdural space. It contains capillary layer of fluid. The spinal dura, which differ from cranial dura. Then the arachnoid mater. The arachnoid mater is a thin, delicate, transparent vascular membrane which invests the spinal cord loosely. Above it continues with the arachnoid mater of brain, and it below extends up to the lower border of second sacral vertebra. Then the pia mater. The pia mater is a thin, highly vascular membrane that closely invests the spinal cord and continues below the spinal cord as a thin thread-like prolongation which is called as phylum terminale. The subarachnoid space between the pia mater and the arachnoid mater is filled with the cerebrospinal fluid. Above it continues with subarachnoid space around the brain. Distal to the termination of spinal cord, the subarachnoid space around the phylum terminale become roomy, forming a pool of CSF called lumbar cistern. The lumbar puncture is done at this site to take out the CSF. The processes of pia mater. The phylum terminale. It is a delicate, glistening white thread-like structure extending from tip of the conus medullaris to the first coccygeal vertebra. The phylum terminale is about 20 cm long and mainly composed of non-nervous fibrous tissue, but few nerve fibers are found embedded in its upper part. The subarachnoid septum. It is a mid-sagittal fenestrated pile septum which connects the dorsal surface of spinal cord with arachnoid mater. The third one, linea splendens. The pia gives off a septum into the anterior median fissure. Where this process gives off, the pia mater present a thickening called as linea splendens. Fourth one, the ligamenta denticulata. These are two transparent ribbon-like thickened bands of pia mater extending laterally between posterior and anterior nerve root from pia mater covering the spinal cord. The lateral margin of each band present 21 tooth-like processes which pierces the arachnoid mater to be attached to the inner surface of dura mater between the point of emergence of the spinal nerves. The ligamentum denticulata help to anchor the spinal cord in the middle of subarachnoid space. Now we are going to learn about the external feature of spinal cord. The external features of spinal cord are the fissures and sulci, attachments of spinal nerves, enlargements, and coda equina. The anterior aspect of the spinal cord present anterior median fissure and two anterolateral sulci, while the posterior aspect present posteromedian sulcus, two posterolateral and two posterintermediate sulci. The enlargement of spinal cord. The spinal cord is roughly cylindrical in shape with an average diameter of about 1.25 cm. However, opposite to the attachment of nerve root contributing to the formation of brachial and lumbosacral plexus. The spinal cord present definite fusiform swellings called cervical and lumbar enlargement respectively. This enlargement produces due to the presence of large number of large motor neurons in this region to supply the musculature of upper and lower limb and associated girdles. The cervical enlargement extends from C5 to T1 spinal segment, whereas lumbar enlargement extends from L2 to S3 spinal segments. Attachments of spinal nerves. There are 31 pairs of spinal nerves emerges from sides of the spinal cord. Of these, 8 are cervical, 12 are thoracic, 5 are lumbar, 5 are sacral, and 1 is coccygeal. Each spinal nerve is attached to the spinal cord by two roots, anterior motor root and posterior sensory root.
The posterior root has a ganglia, the posterior root ganglion, consisting of pseudo-unipolar cells. Each of the two roots is made up of number of rootlets that arises from the spinal cord over a certain length.
The lowest part of the spinal cord is conical in shape and it is called as conus medullaris. The conus medullaris continues below as a fibrous cord-like structure. It is called as phylum terminale.
The spinal cord is shorter than the vertebral column. The length and obliquity of the spinal nerve rootlets increases progressively from above downwards, so that spinal nerves may emerge through their respective intervertebral foramina. As a result of nerve rootlets of lumbar, sacral, and coccygeal nerves from the caudal part of spinal cord take more or less vertical course and form a bunch of nerve fibers around the phylum terminale. It is called as coda equina
Because it is resembles the tail of horse. Finally, the clinical significance. First, the lumbar puncture. The lumbar puncture it is done to withdraw cerebrospinal fluid for various diagnostic and therapeutic purposes. The puncture should be done well below the termination of the spinal cord, that is, the lower border of L1. The most preferred site for the lumbar puncture, the interspinous space between L3 and L4 vertebra. Anterior spinal artery syndrome. The thrombosis in the anterior spinal artery produces a characteristic syndrome. The territory of supply includes the corticospinal tract. This leads to an upper motor neuron paralysis below the level of lesion. Spinal stenosis. It is the narrowing of spinal canal. Herniated disc, a condition which refers to a problem with a rubbery disc between vertebrae. This condition occurs when the soft center of the spinal disc pushes through a crack. The abscess, the permanent absence of spinal cord. The hematoma, it is an accumulation of blood in the loose areolar tissue between the vertebrae. The degenerative disc disease. Osteoarthritis of spine, usually in the neck or lower back. This is a condition of the disc between vertebrae with loss of cushioning, fragmentation, and herniation related to the aging.